Bumex is a diuretic medication that helps the body to remove excess salt and water through increased urine production. It is prescribed to manage conditions related to fluid retention, such as congestive heart failure and edema, swelling due to various causes. Active substance Bumetanide. Indications. Bumex is indicated for the treatment of edema associated with congestive heart failure, renal disease, hepatic disease, and hypertension when other diuretics are ineffective. How to use. Bumex is usually administered orally in tablet form. The dosage may vary depending on the individual patient's condition and response to the medication. It is important to follow the dose instructions provided by a healthcare provider. Typical dosage for edema in adults. Initial dose 0.5 to 1 mg once daily or divided into 2 doses. The dose may be adjusted based on the patient's response. It may be increased at 2 to 3 day intervals. The usual maintenance dose ranges from 0.5 to 2 mg daily. Contraindications. Bumex should not be used in patients with hypersensitivity or allergy to bumetanide or sulfonylurea derivatives. Anuria, no urine production, severe hepatic coma, non-severe electrolyte depletion. Special instructions. Use Bumex as directed by a healthcare provider and follow the dosing schedule carefully. Report any signs of dehydration, electrolyte imbalances, or unusual side effects to your doctor. Bumex may cause potassium and magnesium loss. Your doctor may recommend supplements. Side effects. Common side effects of Bumex may include dehydration, frequent urination, electrolyte imbalances, dizziness, low blood pressure, muscle cramps, nausea. If you experience severe side effects such as chest pain, irregular heartbeat, or severe dizziness, contact your healthcare provider immediately.